Welcome everyone to webinar number 4 of the International Testing Agency. My name is Olya Abasolo-Avchinnikova. I'm an Olympian and the Education Manager at the International Testing Agency. So I will be moderating this webinar, and just momentarily I will introduce my colleagues who you see on the screen here today. As people are still settling in and joining this room, I will take the opportunity to go over a little bit of housekeeping before we kick off. And then we'll really get started. So firstly, I will just explain the functions of this webinar. Here you can see on your screen, you can talk to us through the chat function. So write in your comments if you just want to say hello. And you can put any questions in the Q&A. So both of those tabs should be, if you're on your computer, on the right of your screen. So I can see some messages popping up already. If you have any questions, of course, they go in the Q&A. You can also upvote questions there, which means that if you see a question that you like, you can just click on that, and we will get to the most popular questions at the end of the webinar. We do have a big audience today. We're a few hundred, and so depending on the number of questions, we might not be able to cover all of them, but we'll do our best. If you still have questions after the webinar, our email address is here on the screen, so you can always email us, and we'll be sure to follow up with you. So we've already gotten a lot of messages from some of you from previous webinars, so we're happy to answer any questions or comments that you have that way as well. A little disclaimer from our legal team in regards to our privacy policy. There's a limited number of data that was collected for the registration of this webinar. So your email address and your name, that of course will not be used for any marketing purposes. It's just for us to have access to you and to be able to contact you after the webinar as well. You will also receive a survey from us at the end of this webinar. So thank you in advance for taking some time to fill that out. That will really help us get feedback on the quality of our programs and the quality of our webinars. So please make sure to fill that out at the end. And thank you very much in advance. So this presentation will be recorded. We've already had 3 webinars so far that were recorded. You can see on the screen, anti-doping landscape, doping control process, values, rights, and responsibilities. And those are available on ita.sport. So, of course, this is a webinar on medications, TUEs, prohibited list, supplements, but our final session on June 30th will cover registered testing pool whereabouts, atoms, and the new Athlete Central. So if you want to join that session, you can register just a week before. All right. So I think the room has filled up pretty quickly. And that brings me to the end of our housekeeping for the day. So I will take a second to introduce briefly the other colleagues that you see on the screen. We have Eric Mackenzie here. Hi, Eric.
Hello. Thanks for having me.
Eric is a former athlete who will provide an athlete perspective for this entire session. So we have a lot of questions planned for Eric. You also see Mark Stuart on the screen, who is a pharmacist. Hi, Mark.
Great to be here, Olya. Thank you.
Thanks for being here, Mark. And finally, we have Margo, who is joining us bright and early from Canada.
Hello, everyone, and thank you for having me, Olya.
Thanks for being here. So, of course, I will give a little bit of a more detailed introduction as we get through this session. We have an hour and a half together. But in the meantime, I just wanted to introduce you to our speakers, and I will give you a quick agenda. So the first thing we'll do is we'll hear from Mark Stuart on medications, supplements, and the prohibited list. We have an activity planned for the audience, and one that I will test Eric's knowledge on as well on the medications. So pay close attention. And Eric, I didn't send you the medications on purpose in advance, so you don't know what's coming.
I'm forewarned.
Yes, so we will do that with the audience as well. So there is an activity coming up after Mark's presentation, as well as a few questions for Eric. And after that, we will follow up with Margo's presentation on therapeutic use exemptions. And as always, we will wrap up the session with first a few questions from Eric, for Eric, but then we will take questions from the audience as well. So I think we have a little bit of background noise from Eric, Mark, and Margo. If you just want to mute your microphones, that will help remove the background noise. But at this point, just going to make sure I didn't miss anything. Of course, if you have any questions, feel free to put them in the Q&A. But at this point, I am going to remove this presentation and start off with Mark's presentation on supplements, medications, TUEs, and not TUEs, and the prohibited list. So let's take a look here.
Hello, everyone. Thank you for joining us today. My name is Mark Stuart. Today, I'm going to be talking about medications and supplements and some of the things that athletes need to be aware of when taking medications and supplements. I'm going to be walking you through the prohibited list, give you a bit of an understanding of what's actually on it, and then some tips for you as an athlete to be able to check your own medicines to work out whether they're banned or not banned in sport. So firstly, a very brief overview of who actually sets the anti-doping rules that athletes need to comply with. So the World Anti-Doping Agency, or WADA, is the independent international body responsible for harmonizing all of the anti-doping policies in all sports and in every country of the world. WADA produces the World Anti-Doping Code, and this is a really core document really that harmonizes the anti-doping policies and rules and regulations in all sports organizations around the world. So it's this document that sports organizations and national anti-doping agencies and really sign up to in their commitment to delivering clean sport for athletes. There's another set of documents called international standards, and the prohibited list fits within this suite of documents. And the prohibited list is what we'll be talking about today. So there's about 200 or 300 different types of substances on the prohibited list. And how something actually gets onto the list depends on whether it meets 2 of the following 3 criteria, which you can see on your screen. So first of all, that it has the potential to enhance sport performance, that it improves sport performance, giving one athlete an advantage over another. Secondly, that the use of the particular substance or method could represent an actual or potential health risk to the athlete. So it could cause some sort of harm to the athlete. And thirdly, that the use of the substance violates the spirit of sport. So this kind of violates the ethical use of that substance, or whether the substance is being used for the intention of doping. So it needs to meet 2 of these 3 criteria to be on the prohibited list. So as I mentioned, the health risks of some of the substances on the prohibited list is one of the key reasons why a lot of them are on there. And here you can see on your screen a whole list of side effects, some of them very, very serious. And some of these are associated with some of the prohibited substances that are actually on the list. Now, pharmaceutical companies, they really design and manufacture medicines to treat specific illnesses or injuries. And when used outside of that context for other non-medical purposes, have a significant risk of some serious effects when athletes abuse them or misuse them. The prohibited list is broken into 3 broad categories. So the first one is those substances or methods that are prohibited at all times. So athletes, these are prohibited in athletes all throughout the year, 365 days a year, 24 hours a day. The second category is those that are prohibited only during the in-competition period. Now, generally, the in-competition period starts 12 hours before the start of your competition, but it can vary somewhat between sports, competitions, and events. So it's really your responsibility as an athlete to know when the in-competition period relates to your particular sport and your particular that event, so that you can accurately determine whether a substance is prohibited during that period or not. The third category are those substances which are only prohibited in particular sports, and I'll talk about those in a moment. So the first category on the prohibited list are those substances and methods that are prohibited at all times. And there's a number of subcategories within this. The first of those is anabolic agents or anabolic steroids, and you may have heard of testosterone or clenbuterol as examples of those. Anabolic agents can increase the muscle mass and increase strength, and you can see how these could have a competitive advantage for some athletes in particular sports. So for those reasons, anabolic agents are on the prohibited list. The second category is peptide hormones and growth hormones, and you may have heard of EPO or erythropoietin and growth hormone. Again, this is a very broad category of substances, and there's some medications that are actually within this category as well. Beta-2 agonists. So athletes with asthma need to be particularly aware of this particular section. There's quite a number of medications used for the treatment of asthma. And if you do need to use some of these medications for the treatment of your medical condition, you may need to apply for a therapeutic use exemption. And Margo will be covering that a little bit later today. There's another section, hormones, hormone and metabolic modulators, and insulin is one of the most common examples within this category. Some athletes have got diabetes and may require insulin on a daily basis for the treatment of their medical condition. Again, a therapeutic use exemption, it would be required in that case. There's diuretics and masking agents. Again, some of these are used medically for cardiovascular conditions, for blood transfusions, and intravenous infusions in certain situations. In the hospital setting, intravenous infusions are permitted, but outside of that, they're mostly prohibited. The next category on the prohibited list are those methods and substances that are prohibited only during the in-competition period. So that's generally 12 hours before the start of competition. The first section here covers stimulants. Now this particular group of drugs, stimulants, it's really important for athletes to be aware of these, particularly when purchasing over-the-counter medications in a pharmacy. There's quite a few preparations, particularly those for colds and flus or to dry up a runny nose, that actually contain prohibited stimulants. And this catches athletes out quite frequently. There's a couple of examples there. Ephedrine is prohibited in competition, so is pseudoephedrine. Pseudoephedrine, there's some restrictions around the dose and the amounts of pseudoephedrine that you can use that will affect whether it's prohibited or not. It's really important to check the fine print on any product that you buy in the pharmacies, particularly for colds and flus, to see that there's no prohibited stimulants within them. Narcotics is another category. This category contains a lot of strong pain relieving medications. One of those, for example, morphine, is often used on the field of play in emergency situations for an athlete may have a very severe injury, very painful injury. So it may be administered to you in that emergency situation to relieve your pain. It's really important for the physicians who are administering these types of medications on the field of play to athletes to record their use, because later on the athlete will have to declare that they've actually received these drugs and apply for a retroactive therapeutic use exemption after the emergency care has been provided. And Margo will be talking more about that later on. Cannabinoids such as cannabis and hashish are prohibited during the in-competition period. And glucocorticoids are also prohibited by certain routes. So these drugs are often used in sports medicine for inflammatory conditions, such as the inflammation of joints. Now, glucocorticoids can also be used on top of the skin, and they're used topically for things like itchy rashes and skin conditions. Now, when used topically, they're permitted. When used by intramuscular or intravenous injection, they're prohibited. So the routes of administration really need to be very aware of them, because it can change whether something is prohibited or permitted in sport. The last category on the prohibited list are those substances which are prohibited in particular sports. And the main class of medication here are beta blockers. Now, beta blockers can be used medically for the treatment of cardiac conditions. They're prohibited in sport because they can reduce tremor and create sort of a steady hand, which could be advantageous in particular sports. For that reason, they're prohibited only in the sports where they may confer some sort of advantage, including archery, billiards, darts, golf, shooting, and a few others there, which you can see on the screen. I just wanted to briefly mention these two terms, specified and non-specified substances. You'll see these terms throughout the prohibited list, and different groups of drugs are categorized as either specified or non-specified. These are really legal terms, and whether something is specified or non-specified will affect the length of time that a sanction is applied for at the time of an adverse analytical finding. The key to remember, though, if something is on the prohibited list, it's still prohibited, regardless of whether it's specified or non-specified. These really just refer to the length of sanctions that can be applied if those drugs are used. So I just wanted to give you some tips when reading or using the prohibited list. So first of all, not everything on the prohibited list is a medicine. Some people think that, but there's a whole range of substances on there, from medications that are used for, therapeutically for clinical conditions. But there's also things such as some veterinary medicines that are used in animals. There's some designer drugs used recreationally. There's some other chemicals that are used by laboratories to indicate to help the detection of other prohibited substances at the time of analysis. And there's some other chemicals and substances on there that are currently in research or in clinical trials and not yet registered for human use. Not every prohibited medicine is listed on the prohibited list. And I spoke about the beta-2 agonist section, which contains a lot of medications used for the treatment of asthma. Now, on the prohibited list, there's a really helpful list of some of the most common drugs used for the treatment of asthma, but it's not exhaustive. And just because you don't see your medication on the prohibited list doesn't mean that it's actually not prohibited. There's some other substances with similar chemical structure or similar effect on the body can also be prohibited. So again, just because you don't see your particular substance on the prohibited list, it may have a similar effect or a similar structure to something else that is, which might make it prohibited. And only the ingredient names or the generic drug names are listed on the prohibited list. The list doesn't go into brand names. So for example, if you purchase something from a pharmacy, you'll have the brand name of a product. You won't see that brand name on the prohibited list, but you may see the ingredients that are listed on the ingredients list on that particular product. So just keep that in mind. So how a substance is used can also really affect whether it's prohibited or permitted in sport. The route of administration is important. So that means whether you're taking it orally, whether it's injected, whether it's used topically, whether it's inhaled. All these different routes of administration can affect the status of your drug. And we spoke about glucocorticoids before. So as I said before, topically as a skin product, they're permitted. When used by intravenous or intramuscular injection are prohibited. And when taken by tablet orally are also prohibited. There's some drugs on the prohibited list that are prohibited only in males or prohibited only in females. And the prohibited list also contains some dose restrictions for particular drugs as well. And I mentioned the asthma medications, the beta-2 agonists. That particular section does have some restrictions around how much of the medication you can take before it becomes prohibited. And some sections actually allow for usual general medical use of some of those drugs. But that detail is actually within the list. And I think it's really important to get the guidance of your healthcare provider to be able to help you understand what those restrictions are in relation to your medicine. There's many natural products that won't be specifically listed. So if it's an animal product or a plant product or an animal extract, the prohibited list will only list the individual ingredients that may be found within some of those products. This can catch athletes out as well. Some of those natural products do have prohibited substances as ingredients, but the natural product itself won't be listed specifically on the prohibited list. The ingredients will be. And always check for updates to the prohibited list. So every January, the 1st of January every year, a revised prohibited list comes out. And generally every year, a few extra drugs or substances will be put onto the list, and sometimes things are taken off the list as well. The prohibited list can also be published at any time throughout the year. So it's really important that you have really strong communications with either your national anti-doping agency or your sports federation to make sure that you receive all these updates to the prohibited list when they come out, and you can check that the medications you're on are still, the status hasn't changed since the last prohibited list. But you need to check all your medications on the 1st of January at least to be sure that there's been no changes to their particular status. So you'll see that the prohibited list can be a very complex and complicated document to navigate. You may need to get some help to enable you to understand whether your particular medicine is prohibited in sport or not. And here's a few places where you can go. There's some really good online resources. One of those is Global Dro, and I'm going to show you that in a moment. There's your doctor or your pharmacist are expert in medicines and expert in medical conditions, and they're also perfect people to ask whether your particular medication is prohibited in sport. Just remember, if you're purchasing something from a pharmacy, when you go in, tell them that you're an athlete and ask them if the ingredients within the product that you may be purchasing for your treatment are prohibited or not. They should be able to support you making a good decision in terms of which products to avoid that may have prohibited substances in them, and also support you finding an alternative that is permitted within sport. Your national anti-doping organisation as well is a really key resource to be in contact with. So often the National Anti-Doping Organisation will have a telephone line that you can phone up and ask the status of a particular medication or a supplement, and they often produce websites to enable you to find out whether a particular medication you bought in that country is prohibited or not. One of these websites is Global Dro, globaldro.com. It's basically an online database where you can actually go in and search for the brand names or the ingredient names of any medication that you buy, and it'll tell you what the status of that substance is. Now there's 7 countries that have a version of Global Dro where if you purchase a medication within that country, you'll be able to find out the status of it. So that's Canada, Australia, United Kingdom, New Zealand, the USA, Switzerland, and Japan. It's a really key resource for athletes who may be going to Tokyo for the Olympic or Paralympic Games. If you purchase anything in Tokyo or in Japan, you'll be able to enter that within the Global Dro Japan site, and it'll tell you the status of that drug in your sport. So here's how it works. This is the search function on Global Dro. So you can enter your sport through a drop-down list. I've entered archery here as an example. You can put the nation of purchase. So any of those 7 countries that I mentioned that you could, if you purchased it there, you can select your country and then put the drug. So I've entered ephedrine here because that was a drug that was in an over-the-counter product from a pharmacy, and then press search. Then you'll be presented with a results page. So here's the results for my search for ephedrine, and it shows that in the in-competition period, ephedrine is prohibited, and in the out-of-competition period, ephedrine is not prohibited. So you can see it's a really useful resource to have to hand. Global Dro covers the medications purchased in those 7 countries that I just mentioned, but there's about another 20 or 30 different websites produced by the national anti-doping agencies of different countries where you can actually search for a medication that you purchase in that particular country to find out the status. And there's a page on Global Dro that you can use to find particular other websites of other countries where you may purchase medicines in. It's a really useful reference to know where to find. Lastly, I just want to talk about supplements and some of the cautions and risks that athletes need to consider when deciding whether or not to take them. Supplements can take many different forms, from vitamin and mineral products to homeopathic products to plant and animal extracts or even protein powders. And one of the biggest risks of taking supplements often comes from the manufacturing process. So unlike pharmaceutical grade medicines, supplements, the manufacturing is often unregulated. And the quality of manufacture can really vary between countries and even within countries for different products. Occasionally, some products actually have prohibited substances in them that are not actually listed on the label of that product. And so many athletes get caught out every year after taking supplements and finding that they tested positive for a prohibited substance. Often this comes in because of the poor quality of the manufacturing of some of those products. The risks of taking supplements should really be weighed against the potential benefits that you may obtain from them, and taking really good advice from your healthcare professionals, such as your doctor or your pharmacist, can help you make good and informed decisions about whether that particular supplement is essential for your health. So I'm going to stop there and hand back to Olya, but really looking forward to taking any questions you might have later on in this webinar. Thank you.
So I do want to say a few lines about Mark that I missed in the beginning before the presentation. Mark is a sports pharmacist with over 20 years of experience delivering medical and anti-doping services to Olympic, Paralympic, Commonwealth, and European Games. And Mark was the head of pharmacy for London 2012 Olympic and Paralympic Games, and he is currently the pharmacist expert for the IOC Medical and Scientific Commission Games Group. And Mark is also the Operations Development Manager at the International Testing Agency, so my colleague here at the ITA offices. So you can see and hear years of experience here. I can see already some questions coming up that Mark can answer at the end of the presentation, but I encourage you all to take advantage of having Mark as an expert in this area with us here today to address any of your questions. So once again, Mark, thank you for the presentation. I really appreciate your time here.
It's a pleasure. Thanks very much, Olya.
Excellent. So at this point, we have a little activity for everyone who is with us here today. We will do this together with everyone and with Eric. So Eric, you are right here with us. Excellent. So we'll do this activity together, and Mark and Margo will help us as well. But I want to introduce Eric before we go any further, because we'll start chatting very soon. So Eric is a former Australian rules footballer who played for the West Coast Eagles in the Australian Football League. Eric retired from sport at the end of 2018 and moved with his family to Lausanne to undertake a master's degree at the International Academy of Sport, Science and Technology, which is ASTS. And his career spanned 12 seasons and 14 surgeries. Like all other athletes, Eric had to navigate anti-doping system through competition, training, injuries, surgeries, and recovery. So unfortunately for you, that was a difficult path, but for us, this is such an important experience to hear as administrators, athletes, doctors, medical staff. So we are really looking forward to hearing more about your experience as an athlete, and as you reflect on it as now a fellow retired athlete.
Yep.
But if a picture is worth 1,000 words, then probably video is a lot more than that, worth a lot more than that. So I do want to show a quick clip of you on the field of play. And for those as well who are less familiar with Australian rules football. So let's take a quick look. Awesome. I can see Go Eagles in the chat. So there's some Australian football fans in the
Must be
house.
some Aussies over there.
Definitely. So I can see some fans tuning in. All right. So I hope you didn't forget all of Mark's valuable advice from just a few minutes ago.
I'll try and remember what he said.
Awesome. We're going to test your knowledge, and we're going to test the knowledge of the audience here as well. So the activity is very simple, and you have some support from Mark and Margo, who are back on the screen with us. I will show 7 different medications or supplements, and they will be all numbered for the sake of the audience, so we don't get all the answers confused. So when I pop up a medication on the screen, everyone participating can say whether this is a medication that is prohibited or not prohibited in sport. You can type in, let's say if we show the first one, you can say 1 prohibited or 2 permitted and so on. So we'll see what the responses are like from the audience. And for you, Eric, I'll also give a brief description to help you guess. So Are you ready to play?
Yep, gonna need all the help I can get.
Okay, let's give it a try. Okay, so we have round 1, and you can see the number on the top left for those of you who are participating from the audience. So this is a medication that can be bought over the counter, no prescription required. It is used to treat a common cold or runny nose, congestion, anything like that. So you have the brand name at the top, and then in the red section, you have the medical ingredient. So do you think this is permitted or prohibited?
This one, thanks to Mark's presentation, I was paying attention there. So this is pseudoephedrine. It'll be banned or prohibited on competition days, but on training days and any other time, it's allowed. So it's one of those 50-50 ones.
So Mark, did he get that right?
Phenylephrine is actually a permitted substance. And it's permitted at all times. It's one of those few stimulants that actually you can take for colds and flus that is okay to take at any time, really, for an athlete.
Awesome.
I was close. I was 50% right then.
50, halfway there. I can see people are saying prohibited as well in the audience. But again, better safe than sorry for some of these medications. So always worth checking. But Mark, in Global Draw, you would be typing in which part of this box if you wanted to check this medication?
So I think the key is really look at the fine print here. Sufedrine is the brand name. Phenylephrine, just underneath it, that's actually the drug name. And that's probably the best thing to type into Global Draw, or even to search the prohibited list directly on. You really need to look at the fine print of some of these products.
Okay, thank you. Let's take a look at number 2. So a nice friendly package here with a cup of tea and some lemons. You have another decongestant that can be bought over the counter. So this one does not need a prescription either. Very similar, used to treat a stuffy nose, sinus congestion, things like that. So what do you think, Eric?
I think I'm going to use my previous answer as well. So it's in competition, it's banned with the ephedrine. Which is what I thought the last one was, but then it is allowed out of competition.
Yeah, brilliant. I think we got that right.
That's correct.
Mark?
Yeah, ephedrine is a prohibited stimulant. It's really tricky because it actually sounds very similar to the last one. One of them is permitted and one of them is prohibited. So it's always important really just to check, because the spelling can actually be quite similar between some of these drugs.
Mm-hmm.
Yep.
Okay, round 3. So we've got 2 packages here. They are both Vicks inhalers. And this one is another one that does not require a prescription. You can see, one thing I would note is that they're made in different countries. So one is made in the UK, one is made in the US, and you can see both the brand name, of course, and any ingredients of the medication there. So any thoughts on these 2 packages there?
This was one of the favourite things before a game to clear the sinuses, so it's definitely allowed. So
all right,
is my answer.
It was a tricky one, because if we look closer, and I know that people are tuning in on different devices, so you may not be able to see it, but we will make the presentation slides available after. But if you look at the one on the left, and Mark, I'm not going to try to pronounce that medication name. The one on the left there.
The one on the left has got a drug called levmethamphetamine, which is a prohibited stimulant. And that's the product that you can actually purchase in the USA over the counter. The one on the right you can purchase in the UK, and the formulation has menthol as the active ingredient. So it looks exactly the same. The one in the US has got a prohibited stimulant, and you would test positive for that if you took it in competition. The one in the UK has got no prohibited substances in there as well, so you wouldn't test positive for that one. This is really this is one of the things athletes need to be really aware of. When you're purchasing things in other countries, you may be purchasing the same brand, but the ingredients can differ depending on what country you buy them in. So again, the trick is really looking at that small print, and every new product that you purchase, make sure you look up that particular product uniquely. This has caught a number of athletes out. It's a really tricky one, and as you said, Eric, this is a common medication that's used for stuffy nose and you know, sometimes just before competition as well. So it's really one to watch.
Exactly. And here I can see a lot of comments from our audience as well. So some people were already aware and took a quick look at the ingredients. So menthol obviously is allowed, but there was a case in 2002 that an Olympic athlete competing in Salt Lake did use this. It was a UK athlete who traveled to the US, and of course, having traveled to the US, bought the same medication that he was using back home. And so, unfortunately, this oversight of having purchased a banned medication in the US with a very similar packaging has cost him a bronze medal. So very kind of things that are tiny and sometimes hard to spot, but always worth double, triple checking, even if they look very similar to the package that you use at home. Okay. So we are moving into the area of asthma pumps. So we have a medication here available, I believe, with a prescription that is used to manage asthma symptoms. And so if you have a doctor's prescription, you can use this asthma pump. So what do you think, Eric?
Well, given that most asthma ones contain some type of steroid, I'm suggesting you probably use a TUE and get permission to use this one, given what this presentation's about. So I'm going to say it's banned. So without a TUE.
Margo, you're our TU expert, and you will talk about it in a second. But do we need a TUE for this one, Mark and Margo, or is it permitted without one?
So I will perhaps answer this one. You will require a TUE for terbutaline, which is the active ingredient in Bricanel. Glucocorticoids by inhaled do not require a TUE. So you're right, you will require a TUE, but not for the glucocorticoid, but for terbutaline. It is on the prohibited list, but you would require a TUE for this drug.
Exactly. So that was a good answer there.
I got one right finally.
Well, they were all tricky, so that's okay.
Yep.
It would be too easy otherwise.
Exactly.
Let's try this one. I've got this one in my bag actually. Ventolin asthma pump, very similar to the previous one. And as Margo has mentioned, there are different medical ingredients in different pumps or in different medications. And this one is also used, of course, to open up the airways in the lungs, and you can manage asthma attacks with this one. So any thoughts?
I'm going to go with my answer from the previous one as well. I've seen a lot of people use this. I don't know if it's the same brand, but I'm going to go with the TUE as well. So it's banned.
Banned with a T, unless you have a TUE.
Banned unless you have a TUE. But I'm seeing the answers on the right. They're saying permitted with a dosage.
Let us chip in there. I think, oh, there you go. Oh, you've got the Global Dro search result up there. Salbutamol is one of those drugs where at very high doses it's prohibited, but at lower doses it's not. And there's some rules within the prohibited list around that. And I'll just read them out. Salbutamol is permitted at a maximum dose of 1,600 micrograms given over a 24-hour period in divided doses, but you can't take it more than 800 micrograms per 12 hours starting from any dose. So there is some restrictions around this particular one. Some athletes won't need a TUE because they fall well below the allowed sort of limits. But salbutamol, if it is given through other routes of administration, it can be given by injection or through a nebulizer as well, which can result in quite high levels in the body, and they will need a TUE. Again, it's always good to get advice from your doctor about your particular condition and the dose that you're taking, and check the prohibited list for that.
Thank you, Mark. Okay, we've got 2 to go. This one, a lot of people are familiar with. It's called ibuprofen, and usually is used to treat fever, inflammation, things like cramps or migraines, a pretty common, well-known over-the-counter medication. So any guesses there, Eric?
I'm guessing it is allowed at all times.
Yes. Easy one.
Yeah, I hope so anyway.
It's a very common drug. A lot of athletes will need it at some point in their lives for inflammatory conditions due to injury or sprains and strains. So yeah, that's correct, Eric.
Perfect. I've got 2 right then.
Easy peasy, this one. Okay, last one. So here we have it's not a medication, it's a multivitamin. You can see at the bottom of the bottle, if you can read the small letters, but it says that it's a dietary supplement, and it advertises a formula for athletes that helps support overall health and well-being. So what do you think of this one?
Personally, I would steer well clear of it, just because you often never know what comes in these supplements. But you'd have to look at the list of ingredients of what they've included before knowing if it's allowed or not. So I'm going to say it's allowed, but there's a big caveat there of whether you actually want to take it and risk testing positive due to a tainted supplement.
That's correct. You have to be very careful with supplements there. And like you said, the labels there, and I know Mark can speak to that a bit more, but sometimes they're not too easy to read, are they, Mark?
Very good answer, Eric. And you can see that this is an example label of the side of a multivitamin product, and there's so many different substances and vitamins and things within that. They can be really difficult for an athlete to really determine, if any of those particular things within it are prohibited or not. And then, as you said, Eric, there's potential risks around taking supplements due to contaminants that may be present. So good answer. Yeah, definitely. It's a strong finish. And I can see in the chat that some people say that they cannot see some of the fine print. This is certainly not something you need to see for the purpose of this presentation in detail, but it gives you an idea of the labels that are often seen on supplements. And even below the chart, you have a section that says other ingredients, and sometimes ingredients are not included in the contents or in the label at all. So very important to exercise caution there with supplements. I do want to show as kind of a showcase or as an example, I saw there are a few of you from the US, so you may already be familiar with this, but USADA has a great program. It's a third-party certification, NSF certified for sport, which will test certain supplements. And what I really like about USADA's explanation and the way that this information is delivered to the athletes, I think there's a little bit of background noise. I'm not sure if you are. All right, all good. Oh, maybe not. Okay, good. So you can see here almost a scale when we talk about supplements, that even those that are considered NSF certified for sport are not in the zero risk category. So I do like this depiction visually. Really, zero risk comes with zero supplements, unfortunately, but there is a way to minimize that risk. And so I encourage you to check with your local NATO. This is just one example in the US. And there are many others out there that do work with supplements that can guide you as athletes or athlete support personnel in that area. Okay, so that wraps up our medications activity. I didn't keep score, Eric. What did we get?
I got 8. I think
on 7.
I went just above 50%. I think. So that's a pass. That's a pass. I'll claim a pass.
All right. Thank you, Margo and Mark, for your assistance with this one. I do have a few questions for you, Eric, before we move on to Margo's presentation.
Yep.
And obviously, you've had a very long and very successful career.
Thank
but
you.
We saw from the highlights reel that is a very intense, high-paced sport. It's a contact sport. There's a lot of tackling, a lot of injuries. One thing I didn't expect, you running into the post.
The post, yeah. There's dangers everywhere, not just the players.
Indeed, to everyone around. But how did you maintain your health as a person, but as an athlete throughout this whole time? Did you rely heavily on medications to be able to continue to play?
Yes, so it was a combination of, we had 3 full-time physios plus a couple of other part-time physios there. We had massages, which we could get daily, as well as a nutritionist, full-time S&Cs, but then we also had doctors there as well. So a lot of it was supplementing those type of things when we needed it, because it's a 23-week season plus finals, so it certainly takes the toll on the body. So a lot of it in the season is about maintenance. So there was a lot of things I took just to get up to train and to play. So I had a lot of anti-inflammatories while I was playing, which just to cover a lot of the knocks and those type of things. For games, I took beetroot juice prior to help with the endurance and recovery side of things. But then in terms of my recovery after games and just a maintenance type thing, I took glucosamine and fish oil to help with my joint health. I had a lot of, with my 14 surgeries, they were all on joints, so they were worried a bit about the cartilage health and the long-term effects of arthritis and those type of things. So I supplemented my diet with the glucosamine and fish oil to try and get some benefit from those type of things. And then also in regards to playing, there was caffeine and Panadol as well.
Caffeine is my drug of choice as well at the moment.
Exactly.
As a retired athlete.
That's good, and I'm glad they've got rid of the limits on it for game day.
Yeah, when I was competing, there was a limit, I believe.
Yep.
And you're in a team sport where, typically, and I don't want to say that about all team sports, but a lot of the time you have a team physician who's really kind of controlling what everyone on the team is taking. And so how much did you rely on your entourage, your athlete support personnel, coaches, and doctors for those choices of medications and supplements?
It was huge. I pretty much relied on them and trusted their opinion. Also, if I ever asked, I'd always challenge them on what the benefits were, the risk reward of taking these type of things. If I wanted second opinions, they'd go out and get second opinions as well. But everything I took that went into my body went through our doctors and nutritionists. So anytime we had supplements, those type of things, we got them batch tested. So we were very lucky in that regard, in that they made sure everything we did was above board.
Yeah, excellent. And that answered my question about supplements as well. So it's such a good source of information to have a batch test. Certainly not something that all the countries have access to, but there are certain NATOs that do batch testing.
So yeah, we're very lucky in regards to having that. I mean, it is a costly exercise, but the benefit of it is you don't run the risk of that. And I think people often rely on supplements too much, as opposed to trying to get it through a healthy diet and those kind of things. So they use the supplements as a meal replacement, almost as a cheat. So.
Yeah, indeed. I have the best question, I think, this is webinar number 4 for me, but the best question I have is from Ross that says, can Eric explain how the Eagles lost to the Gold Coast Suns on the weekend?
That's a very good question.
It's okay, you don't need to answer that one, but I thought I'd pass it on.
And there's obviously a few people from Perth or from Australia over there, and I think that's the second time ever we've lost to them.
And I think Brad here is saying easy because Eric is retired, so that's the reason for the loss.
Yeah, easy was also my nickname at West Coast, so there you go.
That's right. All right, Eric, we'll come back to you in a second with a few more questions. Thank you for this. I am going to now turn it over to Margo for the presentation on therapeutic use exemptions, which I can see already that we are getting questions on TUEs. So I am going to introduce you, Margo, and then we'll kick it off with this presentation. Margo is a former international level artistic swimmer and is now a member of the FINA governing board with a portfolio of sport medicine. I almost said synchro, artistic swimming. She's also the chair of the ASWAF Medical and Scientific Group and is a member of the IOC Medical Commission's Games Group. Her work in anti-doping also includes 20 years at the Canadian Centre for Ethics in Sport, which is our Canadian NATO, as the TUE Committee Vice Chair, a mouthful there. She works internationally in anti-doping as a member of the World Rugby Anti-Doping Advisory Committee, on the TUE Committee of the Olympic Games, and as chair of the TUE Committee at the Youth Olympic Games for ITA, International Testing Agency, in Buenos Aires in 2018. So once again, thank you for being here, Margo, a wealth of experience, and we are grateful that you've agreed to share that with us today. So let's kick it off with the presentation, and then we still have time for questions at the end of this. So let's go ahead.
I'm going to change the focus now from the prohibited list to therapeutic use exemptions. And this is something that anyone involved in anti-doping, whether it's an athlete or in an anti-doping organization, should be familiar with. So I'm going to take us through some of the key tips on therapeutic use exemptions. What it is, why do we need to have one, who needs to have one, when do you apply, how do you apply, and finally, I'll end up with some practical tips. Let's start with the what. So what is a therapeutic use exemption? Well, as an athlete, if you have a particular illness or an injury that requires a specific medication, and if that medication is on the prohibited list, you can apply for permission and be granted permission as a therapeutic use exemption to use that drug within the context of sport regulations. So this therapeutic use exemption allows you to compete and train while using the prohibited substance. There are some criteria that must be met before you get a TUE. For example, your health, you have to prove that your health would be significantly impaired if you did not take the substance. You have to prove that your substance does not enhance your performance beyond what brings you back to a normal level of health compared to your other athletes. You have to show that there are no alternative treatments available that are not prohibited. And finally, you need to show that the need for the use of the prohibited substance is not resulting from the prior use of a prohibited substance. So those are the four main criteria, and that is set out by the World Anti-Doping Association in the International Standard for Therapeutic Use Exemptions. So whenever anyone applies for a TUE, those are the four criteria that are evaluated. So what are some of the common health conditions that may require the use of a prohibited substance and therefore require the application for a TUE? Well, one fairly common in athletes is asthma, attention deficit disorder, diabetes, infertility or polycystic ovary syndrome, inflammatory bowel disease, intravenous infusions outside of the hospital, certain musculoskeletal conditions, and acute sinusitis. Now, you're not actually granted permission to have these illnesses. You're actually granted permission to use a substance that's used to treat these illnesses within the sporting context. So you can then compete and train while using that substance. So what I've just brought up, this box in green, is on the WADA website. And this cross-references the diagnosis that I've mentioned here with the specific drug that's on the prohibited list. So what I've shown you here is not an exhaustive list. There are many more conditions than listed on my slide here. And of course, there's many more medications that are prohibited that are not on this slide. But this gives you an example that if you as an athlete has attention deficit disorder, you may be prescribed dexamphetamine or methylphenidate, in which case then you would need a TUE to use that drug if you were going to compete and train with this substance. Let's bust a myth here. There are some people in the world that believe that therapeutic use exemptions give the athlete a competitive advantage and therefore a higher rate of winning if you take a drug and use the TUE to cheat. So there's been a recent study, quite a good one, in the British Journal of Sport Medicine by Alan Verneck and David Healy. Alan Verneck, of course, is the WADA medical director. And he looked at how many people had a therapeutic use exemption and then how many people had won medals in every Olympic Games from 2010 to 2018. So a very interesting study. And in conclusion, the number of athletes at the Games with valid TUEs is actually less than 1%. And there was no meaningful association between the granting of a TUE and the likelihood of winning a medal. Very important fact. And in fact, therefore, as a sport physician, we can reassure our athletes and our coaches that the TUE process is well controlled, well regulated, and there's not a rampant use of TUEs to cheat, to gain an unfair advantage to win a medal. Let's move on to why we need to use a therapeutic use exemption. Well, very important that the TUE process helps you avoid the risk of a sanction in a positive test. For example, if you were to obtain the treatment that's prohibited for a legitimate medical condition, even if that treatment requires a prohibited substance, and you are tested and the substance is found in your urine, if you have a therapeutic use exemption, there will be no sanctioning and no process of an anti-doping rule violation. So that therapeutic use exemption actually is very protective for you as an athlete, that allows you to take the medication you require for your illness, even if it's prohibited, and allows you to compete and train without the risk of being sanctioned. Who needs one? Very good question. If you're an athlete that's subject to doping control, then you are the athlete who must request a TUE before you take the medication. And please be reassured that all of the information in the TUE process remains strictly confidential. So when should you apply for a TUE? The guidelines suggest that you must apply at least 30 days before taking part in an event. I encourage you to apply for a TUE as soon as you are prescribed the prohibited substance. Don't wait for the event. There is something called a retroactive TUE. So what if it is an emergency situation and you don't have time to apply? So if there's emergency treatment that's required, you can then activate what's called a retroactive therapeutic use exemption. So even if it's not quite an emergency, but there's insufficient time or opportunity for you as an athlete to submit your TUE, or insufficient time for the Therapeutic Use Exemption Committee to review your application prior to the time you had your sample collected, then you can be granted a retroactive TUE. And this is very important. If you were prescribed something, you started the process going, and then all of a sudden you were tested the next day before you heard back, you can be reassured that as long as you've had the process in motion, that you will be granted a retroactive TUE, as long as you meet the criteria. And for instance, in some anti-doping organizations, some anti-doping rules actually permit the athlete to apply for a retroactive TUE. For example, in Canada, if you're a varsity level athlete, so a collegiate level athlete, our Canadian anti-doping rules allow varsity athletes, if they're tested and they know that they are being treated with a prohibited substance, they can then apply for a retroactive TUE. So you be very careful to know what your anti-doping organization rules are. And the final way you get a retroactive TUE is if both WADA and the anti-doping organization to whom you're applying, they feel that it is in fairness to require the granting of a retroactive TUE. So this last caveat gives some room for interpretation, gives some room for the anti-doping organizations to decide that, in this situation, it was actually fair and there was no opportunity otherwise to apply for this TUE. So it is a very nice caveat that is in the IS, or International Standard for Therapeutic Use Exemptions. Let's move on to how. How do we apply for a TUE? You can request the TUE from your anti-doping organization or through the ADAMS. And if you're an ITA partner federation, you can go to the website at the International Testing Agency to request a TUE. When you're filling out the TUE, both the athlete and the physician must complete separate parts of the therapeutic use exemption form. And then the form gets sent to the anti-doping organization that you're responsible for. So very important that it's the athlete's responsibility to get the TUE completed, and you must get your physician to fill out the medical part. And as an athlete, then you must send your TUE form into the anti-doping organization that you answer to. You may be a national level athlete and you answer to the national anti-doping organization of your country. Or if you're an elite international level athlete and you are in a registered testing pool where you send your whereabouts information on a daily basis, then you may be applying to the International Federation. So if you have any questions, you should ask your local anti-doping organization, who do you apply to? And they will be happy to direct you to the correct anti-doping organization. Please include all of the details in your documentation. If you don't have all of the details, the TUE will not be granted. It'll be returned to you, the application, for you to complete the application with full documentation. At that stage, a panel of experts will review the file and they will grant the TUE for a specific substance at a specific dose for a specific duration. So that's very important. It's not a free opportunity to use as much of the drug for as long as you like. It's a specific substance at a specific dose for a very well-defined period of time or duration. So if you are applying for a TUE, it's very nice that WADA has developed this checklist. Now I give you an example here, and I know it's difficult to read, but each checklist is for a different diagnosis. They can be found at the website at the bottom of the page. And what this checklist is categorized by the health conditions. So this one in particular is for intravenous infusions, but they can also be for many others are on file at this WADA website. And they come in different languages, so that depending on where you are in the world, it is already translated for your physician, so they can make sure that they have the right criteria included and diagnostic supporting information. And you also can make sure that everything that's required for that particular substance, for that diagnosis, is included in your TUE form. Very helpful information here. Please use this website and this checklist. It saves a lot of time if you fill it out right and completely the first time, so that you can avoid time delays when you're going back and forth for missing documentation. We're going to close now with some tips, some practical tips to help you. First of all, make sure you keep your medical records up to date. Please attend your physician's appointments regularly and follow through on any procedures or diagnostic tests that are required for your illness. If the medical records are up to date, it's much easier to prove that you need the prohibited substance for that condition. Please remind your physician to look at the WADA medical information guidelines. Very helpful for physicians to know what they're supposed to include. Very importantly for everyone listening to this today, please check the WADA prohibited lists when you receive a prescription. A lot of physicians do not know the prohibited list well enough to recognize when they may have given you something that's prohibited. As an athlete, it's your responsibility to say, hey, I'm an athlete that's subject to drug testing. Is what you're prescribing on this piece of paper here? Let's check if it's on the prohibited list before you take it. As I mentioned before, and it is certainly worth repeating, please make sure your application is complete and accurately filled out. If you have a change in dose, you have to apply for a new TUE. And this is really important. As I said before, you're granted a TUE for a specific substance at a specific dose for a specific duration of time. So if your physician changes your dose, you then have to reapply for a new TUE. Keep track of your expiry date. Remember the TUE is granted for a specific period of time. So if your TUE expires, then you are not protected under the therapeutic use exemptions. Please renew your TUE before it expires. So what if you're being tested? What should you do if you have a TUE? Well, number one, declare your medication on the doping control form. Please write down everything you've taken and particularly that you've taken this TUE substance, this prohibited substance for which you have a TUE. Please declare it on the form. And then on the form next to that substance, specify that you have a TUE that's been granted. That's very helpful to say, I'm taking this substance, it's prohibited, I have a TUE for this substance. And should you happen to have a copy with you, please show a copy of your TUE approval to the doping control officer. Those are the tips. I hope you find them very helpful. And remember that the TUE program is there for you, and it's to help you should you need to take something that's prohibited so that you can be granted permission to do so in the context of being able to use that drug while you're training and competing. If you have any questions for me, please put them in the Q&A and we will address them in due time. Thank you for your attention.
Thank you, Margo. So I can see already a lot of questions piling up in the Q&A, so thank you for sending those. I'll just make a quick reminder that the questions should go in the Q&A and not the chat, otherwise they will get lost. So just make sure that you're asking there, and a lot of good questions already. You may have noticed that some of the presentations that we have were pre-recorded, and that was to combat some of the technical challenges that we had, but we are all here live with you now. And I'm going to kick it off with a few questions for Eric, and then we'll have a good 10-15 minutes for audience questions as well. So once again, Margo, thank you so much. I think it was super, super helpful, and it ties right back into the story of Eric. Eric, you have had an interesting journey as an athlete. I do want to give a little bit of a context for those that are not familiar with your career here.
Yep.
So you had an arthritic condition that affected both of your big toes and you on your feet, for which you were prescribed an experimental drug in 2018, but you were dealing with this condition since 2016, initially treated with some of the well-known stuff, strapping, mobility, anti-inflammatories, monitoring of your training loads, and so on. But it did get progressively worse, 2016 and 2017 seasons, right?
Yes, correct, yeah.
And I guess you were having monthly cortisone injections by the end of the 2017 season.
Yep, so they started out the 2017 season, started having monthly jabs, and by the end of the season for finals, they were almost weekly cortisone jabs in them just to get up to play, try and get some mobility back in them.
Incredible. And then you ended up having a surgery in 2017, which didn't help. Is that?
Yes, yeah.
Right?
The end of the end of 2017 season, it was decided to try and have surgery to try and increase the movement back in the toes. After we'd been trying all year to strap them and stop the movement, we thought we'd try and go the opposite way. Mm-hmm. And after that, I was in severe pain pretty much for all of 2018 and didn't play a single game. And that's why I ended up having to retire.
It's unfortunate to retire with an injury. Sometimes we
predict how it's going to go. Not the way you want to end, but it is what it is. I'm happy with the career. But
yeah, absolutely. And you've got some fans in the audience.
There's a few there.
Mm-hmm. What's interesting is that the drug that you were prescribed, it was not available in Australia. So your doctors had to sign a waiver to get it through customs from Italy. which you got a TUE for that. And I'm going to follow up with a question to Margo about this in a second.
Yep.
So yeah, I mean, TUEs for cortisone injections, anesthetic injections, drugs prescribed post surgeries and returning to the field of play, a bunch of things. I guess you were dealing with a big amount of pain and injuries. So how did these TUEs, so that permission to be able to take those medications, how did it help you continue to play as long as you did?
Yes, so probably at the time it enabled me to continue playing. I certainly now feel a lot of those injuries, and I don't know if the long-term health of these, by taking these pain-killing injections, anti-inflammatory injections, I'm not sure what the long-term consequences are of me being able to put my body through more pain. But at the time, I certainly signed up to do them, and yeah, I did need a TUE for them, but that was all sorted out by our club doctors, and everything was approved by them, the AFL, which is the governing body. So it was all above board in that regard, and I really didn't have to do much at all except stand there and watch the needle go in.
And that ties into your presentation, Mark. You've mentioned there was a list that you showed during your presentation of kind of categories of prohibited substances, and I kind of checked off mentally some of those things as we were talking about Eric's sport and medical history there. You're on mute, I think, Mark.
Mark's muted.
Yeah, you're back.
It's interesting, Eric, you said you had a substance that was not licensed for medical use in Australia, and there's a category on the prohibited list. It's the S0 category, and that's for non-approved substances. And something can fall into this category if there's no current approval by the government regulatory agencies in your country. And things like drugs in clinical development can sometimes fall into that category. So potentially the drug that you were prescribed there could possibly fall into that category. That's certainly something for athletes to look out for. You know, it's sometimes these drugs are used in a non-licensed kind of a way if there's a genuine medical need. That may be in your case, Eric.
Yeah, so this one was actually a drug that the veterinarians use for animals and their arthritis. So you do feel like a bit of a guinea pig at time. Athletes are always at they're pushing their bodies to the limit. So sometimes they do experiment a little bit. We're probably more willing to accept the risks given the rewards from it. I'm not sure if that's a good or a bad thing, but sometimes it can help get these drugs approved into more clinical trials. So yeah, we had to get approval by the government to get it in the country, government to use it, and then the AFL, and then obviously the TUE to use it as well.
And Margo, have you had experiences like this? You have many years working on TUE committees. So for me, that was the first time hearing of such a process.
Yes, certainly. I worked with TUEs from around the world at Olympic Games, and there are, as you can imagine, different medical practices around the world. And I've certainly learned a lot how medicine is practiced differently, and there can be new medications that are used, and we always have to keep up with these. And certainly when Eric, I heard of your story, I actually had to look up that medication. I don't prescribe that veterinary medication on a daily basis in my sport medicine practice.
Probably so makes sense.
Yes, I don't think I'll start, but nonetheless, it is, as Mark said, that's what the S0 category is for those substances that aren't yet quite classified or qualified yet for that substance, so kind of an off-label use. So TUE committees are comprised with experts that have a variety of backgrounds that can help inform. And if the TUE committee doesn't have the expertise, they can actually bring in an expert to become part of their ad hoc TUE committee to advise them in that particular area of expertise.
Yeah.
Eric, you also mentioned you had a injectable cortisone, I think, and cortisone that actually fits into the category of glucocorticoids, which is on the prohibited list, which is prohibited in competition, and it's prohibited by intravenous and intramuscular administration when injected. So potentially that may be one of the routes of administration that was administered to you. And was why you needed that TUE.
Yep, yeah, so they were injected on game day and training days as well. So, yeah, there would have been a TUE for those too.
Okay.
It certainly as a TUE physician, I get that question a lot. I'm using glucocorticoids. Do I need a TUE if it's just outside of the joint, or if it's around a tendon, versus if it's inside a joint, or if it's oral versus inhaled? So it's a tricky part of the list to know which part of the glucocorticoids require a TUE, which route, I mean, not which part, but which route, and which route does not require. So it's, it's really worth looking it up to make sure that the route that you have is, permitted or not. And of course, as Mark said, only in competition.
And I'm also hearing a lot of the time from Eric's answers that I just want to emphasize for everyone listening how important the coaches and the entourage of the athlete are, because for you, Eric, to deal with all these TUE surgeries, recovery would have been extremely difficult, but they were really leading the way for you there.
Yeah, for me to sort that out, it would have been a nightmare, and I probably would have stuffed it up. So I was very lucky I had people who I trusted and had my best interests at heart to sort out that system. And we're lucky being in a team sport environment and a well-funded sport that I had access to that. It would be very hard not having that. I would have had to educate myself a lot better.
Absolutely. Well, I think we still have a few minutes. I want to go to the Q&A part because it is filling up very quickly. So, Eric, thank you for your insight as an athlete. I really appreciate it. And just hearing really the actual practical real life aspect of it all, bringing the presentations that are theoretical to life is super helpful. So thank you.
My pleasure.
So we'll stay online, all of us here, and try to tackle as many questions as we can from the Q&A, pun intended. And if you had a question in the chat and it disappeared, I'm not deleting it. I'm just moving all the questions to the Q&A. So please do rest assured that I'm not deleting any of your comments. So I am going to take the top rated questions here. We've got 12 minutes to address those. And I'll start with Armando. So he's asking, which online database, like Global Dro, would you recommend for checking supplements? So Mark or Margo, do you have any thoughts on this?
Sure, I'll take that. So you're right, Global Dro doesn't cover supplements as part of their editorial policy, only to cover licensed medications in all of the countries. So, I mean, supplements are really tricky, and I think that there are some other really good websites. Safe Sport is one of them. Ollie, the one you showed up before, available in the US, that's another one. These can be really helpful for athletes to really sort of reduce some of the risks when taking the supplements. I think one of the best things for supplements available in your country to have a talk to your national anti-doping organization. And often in your own country, you will have some sort of support system or advice system that can really guide you in terms of selecting the supplements that are going to be the least risk for you.
I would also encourage an athlete to consult the physician for the actual need for that supplement. Because quite often people take things because their teammates are taking it, but maybe their teammate is taking it because they have a health need and you don't have the same health need. And connecting, and I would say a sports physician, not just a regular physician, because a regular physician may not be quite as informed. And as well, a sport pharmacist or a dietitian. Sports dietitians are actually quite knowledgeable as well.
Great. Okay, so we have a question from Thomas now. And he's asking how the expert committee that decides the prohibited list evaluates the evidence level for performance enhancement or medical risk criteria. And is the decision based on an average effect or pooled effect across the population, or is it based on empirical scientific studies in humans or plausible biological evidence?
That's a Mark.
And I certainly can't talk on behalf of the list committee, but generally, there's so many different pieces of evidence out there that can contribute to some of these things. I mean, there's certainly human studies where they exist. There's some studies of medications or drugs in sort of animals in vivo or in vitro. There's case reports of athletes taking particular drugs and how that affected them. There's various sort of prevalence data that's out there in terms of the numbers of athletes who are actually using these drugs. There's a lot of information from the pharmaceutical industry as well that have gone into the development of drugs for therapeutic use and medical use, and a lot of pharmacological sort of evidence in terms of drugs that have got similar structure or effect to other drugs that are out there. So I mean, I think the range of evidence that could be used to determine whether something is performance enhancing is really varied. So it can come from many different sources.
Okay, great. Thank you, Mark. Now, a question from Ross is directed to Mark, but I think I'll take this one. And Mark, you let me know if you have any further comments. Ross is asking about a number of recent cases where athletes have tested positive for a prohibited substance after unsafe sexual encounters with those who were using prohibited substances. And so the question is about the testing regime that was used and then the subsequent clearance. And it says, example, US boxer. So this one is a tricky question because I think it becomes more of a legal question, which would be, I think, better tackled from the legal perspective on contamination and especially the testing regime. I don't think we could answer that one either. And I am not sure about the specific cases of certain athletes. I think maybe we can stay away from talking about specific cases.
Without sort of talking about specific cases, it is an interesting concept, really. But I mean, Ollie, to make the point, the testing at the moment is done either blood testing in athletes or urine testing in athletes. So it's those two parameters that are used to detect prohibited substances. And then you've got all the issues around sort of the elimination, how they're actually excreted in the body. And I guess some of those issues would probably come into considering a case like these. But they're very complex cases. And it's been interesting to watch the recent ones over the last couple of weeks unfold.
And Ross, if you do have follow-up questions for us, I know we didn't give you a direct answer. We can always connect through education@ita.sport. I can get my legal team to give a better answer as well. So certainly we can continue that communication if you'd like. Okay, so I can see now a question from Sanit. Can TUE be applied and taken for the entire year in case an athlete is using insulin to cure diabetes? Maybe Margo?
Okay, so I'll take that question. It's a very good question. And, the TUE is really a wonderful thing for athletes who have diabetes because, of course, insulin is on the prohibited list, but it's required for your health. It's required for life. And so what I often recommend is that when you apply for your TUE, that the TUE committee can actually grant it for, as I said, a specific duration of time. So in fact, rather than having to reapply every year, we recommend that most TUE committees, and it's in the guideline, that we actually can grant that TUE for an extended period of time. That might be 2 years or 4 years, so that you don't have to redo every year. Because if you're insulin dependent, it's not going to go away in a year or the next year or the next year. You're on it for life. So we extend the duration. And often the TUE committee will also give you a range, because we also know in diabetes that the dose that you start on may not be the dose that you will be on in a year or even in a month or even next week, because your needs can change over time. So quite often the TUE committee will grant you a range of a particular type of insulin for an extended duration. Please be careful and watch it, though, because if you do change either types of insulin or your dose range goes outside of that criteria, you may need to reapply to have that updated. So, we do take special precautions with diabetics to give you some freedom so that you're not applying every week as your dose changes. There's often a range and an extended duration of the TUE.
Okay, great. Thank you, Margo. Lots of questions, so I'll move on to Steve and we'll get to as many as we can. Is there a way of ensuring equivalence of granting of TUEs in different countries across the world?
So I'll take that question as well. And thank you for your question. This is really important. And it's important to the people that made the TUE rules that if you're an athlete in one country, say you're in the USA and you're an athlete in the Philippines or Qatar, that you have the same rights to a TUE for the same substance. And so that's why there's some medical guidelines. That's why there are guidelines for granting a TUE. And these are fairly standard, and the recommendations are on the WADA website. If you feel you've been unfairly treated and that your TUE was denied when you think you should have been denied, there is an appeal process that you can go through, and then the WADA TUE committee can hear that appeal and perhaps potentially change the original decision. It is a process that's well defined through the WADA website on how you can manage that. But the international standard for testing does try and standardize the TUE process. So an athlete anywhere in the world should be working under the same set of rules for granting of a TUE.
Great, thank you. I was just reading the question from Martin, and it's a complicated one. Let me know if you can answer this one. What about the processes of and drugs that are meant to lower testosterone and their imposition on athletes? Cass, in the Daddy Chant case, found that there's lack of evidence that testosterone increased female athletic performance. Since 05-219, and I'm not sure, I guess it's a reference to the amount, is imposed on athletes. The main question is whether WADA will take a stance on reverse doping in the future. And I know we cannot speak on behalf of WADA, but I don't know if you have any questions, Margo and Mark.
Well, it's a complex one, and I think it is probably a question for WADA actually, rather than this group here. I'm not actually familiar with that case that's being referred to there, but I think the issues around testosterone, particularly in female athletes, is a really complicated picture and a challenging one to sort of address. Margo, I don't know if you have any thoughts on that.
Yes, I mean, we are not speaking here on behalf of WADA, and whether WADA will take a stance, that's not for us to decide. And I am quite familiar with this case because I do work with women, female athletes, and I particularly work with track and field athletes for athletics. And it's also got to do with the World Athletics rules with respect to testosterone levels, of which I'm not a member, so I won't comment on that. But it's a very important question that's been in and out of the courts. So again, there's legal components as well as WADA components. So we're not really answering your questions to say thank you for it. It's certainly an area that's under much study, under much legal contention. And I think we all need to stay tuned to learn how to best handle this so that it's fair for all people involved in sport.
Absolutely. All right, we've got 2 minutes, and I am going to ask Eric a question here from Iris. And I think it's a good one from the athlete perspective. What was your experience, or did you have any experience with a pharmacist to provide drug counseling and monitoring with all the medications you were taking?
That is a very good question. And no, we didn't have any, I didn't have any experience with a pharmacist in and around the drug counselling. We had education sessions run by the AFL and by our clubs. The AFL is the governing body, and our club ran them as well. But in terms of monitoring the medications we were taking, it came in after 2012. There was a bit of a supplement scandal in the AFL. And so every Monday morning, we would have to log in to an app, which then record, and we had to record every supplement we took across the last week. So, and then this would go back into the AFL database as well, and they'd then be able to cross-reference that as well to make sure everything that people were taking was, well, there was nothing on the prohibited list, and also that there was consistency throughout the clubs in their reporting and those type of things. And if there was going to become an issue with abuse of certain drugs at certain clubs, so whether it's the anti-inflammatories or the painkillers and those type of things. So that was something which the governing body implemented to make sure there wasn't an abuse of these drugs, and to make sure we knew what we were putting in our bodies as well. So I hope that answers that question.
Yeah, absolutely. And even Mark, I think sports pharmacy is such a huge subsection of general pharmacy that it is a good reminder to be very careful when we are using any kind of general pharmacy and medical advice from somebody who is not qualified in that area.
I'd certainly endorse the use of your local pharmacist as well. As I said, they're experts in drugs, and they've often got a lot of resources to hand that they can look things up if they don't know it themselves. But you're a pharmacist or a physician is a really good place to ask some of those questions. But
yeah, great. And that brings us quickly to an hour and a half into our webinar. I want to thank our presenters and our speakers for today. So Margo, Mark, and Eric, thank you so much for your time. I am sure that this was really helpful for the audience. I can see we didn't get to all the questions. once again, I will remind you that we are available at education@ita.sport if you want to reach us with your questions. And I'm just going to pop this address up on your screen so you can see it. And you can also reach us at on our social media, and you can follow to look out for the next registration link for the final webinar and just any general updates. So quick reminder, June 30th is our final session. We'll talk about the registered testing pool, whereabouts, atoms, and the new Athlete Central. So that will be our final webinar of the series. And also a reminder to please complete the survey at the end of the session. So once again, thank you to the audience for your participation and your questions. Thank you to the presenters. I wish everyone a good morning, evening, night, whatever part of the world you are in. And we'll be online very soon again with our session number 5. So thank you. Bye, everyone.
Thank you.
Thank you.